Hi guys, Shelly and Jason. I'm an IU bachelor degree research nurse, and Jason is also an IU bachelor degree research nurse who even has more experience than I do working with infection control. So Jason and I wanted to come on and just talk about, we have a lot of people that ask us a lot of questions, and we try to address the questions because we are research junkies and we look at all the research. So people want to know, who is at most risk for the virus? This virus is more devastating the older that you get. So most of our people that are 50 years and younger are not going to have a fatality from the virus. The rates are shown to be about 4% of fatalities if you're 50 years and under. Now, when we get up to 60 years and over, our risk actually goes up for fatality to 20%. As we go up to 70, our risk goes up to 30%. And as we get up to 80 years old, the risk is almost 40%. It is 40% for fatality from the virus. So it's really important that we protect our elderly people, or our most vulnerable population. So not only is it about age, but it can also be about people with other underlying health conditions or suppressed immune systems that are at higher risk. So these are things that you guys need to think about. We caution you guys because it seems like you guys are the ones that are at the Walmart the most now that they have special hours to let you in. So we've seen kind of lines standing out the Walmart waiting to go into the store, which, since they supposedly are counting people in the store, we've never seen them count anybody, but there is now a little area that you have to go to enter the store, and they have it taped off with caution tape, and it's more like coddling people into the store where you're in closer proximity and you cannot really maintain your 6-foot social distancing. So there are concerns about this. So we want you guys to be aware that some things may be giving you false security, like the mask, for instance. We're glad that you're wearing them. We're glad that you're wearing gloves, but we're worried about cross-contamination with these things. So the best way to protect yourself is not to go out into these places. Anytime you go somewhere, you always leave a trail of DNA behind. Check a crime scene. There's hardly ever a time that they can't find a trace of DNA, because even though we're trying not to, we still spew out stuff.
Or you touch your face.
And I just touched my face probably 30 times in this video. That is what's going to happen to me, you guys. I'm going to do all kinds of crazy stuff in my life, and I'm going to get taken out because I touched my face. So just warning to you guys, we love you. These are things that we want you to think about to keep yourself safe. Right, Jason?
That's right. You just wash your hands, keep that social distancing away. They're showing maybe up to 13 feet now is how far you need to stay away from people. The research and data is evolving.
Just evolving.
Yeah, and they're looking at this might even be partially airborne. So the masks that we're making are better than nothing, but it does more to protect other people than yourself. So just realize that. It's more of a protecting others, loving others.
Yes, and be careful when you guys do come out of the stores with those masks on. Don't just throw them on your dining room tables and in your cars, like Jason and I showed. Maybe keep a big Ziploc baggie that you can kind of put the mask down in, because if you're walking there to protect yourself and there you have a face mask on and it's collecting particles, you don't want to lay it down and get particles on everything around you.
And sunlight, the UV light will kill it eventually, but it takes it a while.
And we're not sure, because there's all different statistics on that too, and research, and they tell us this and tell us that. So just try to keep each other safe. Take care of each other, you guys. We love you.